Good morning. I'm Dr. Gilles Eloi Rwibuka from Burundi, non-physician anesthetist and critical care specialist. I'm the chair of ATSARPS, the Association of Anesthesia in Burundi. I'm going to share with you today a Lifebox work in Burundi since we have started to work together. Burundi is a landlocked country located in East Africa, bordered by Rwanda, Tanzania, Democratic Republic of Congo. Burundi has a population of approximately 11 million and the second highest population density in sub-Saharan Africa, with 87% living outside urban centers. We have life expectancy of 50 years for men and 62 years for women. We speak Kirundi as the mother tongue. French, English, and Swahili are widely spoken. Anesthesia-wise, there are currently 5 physician anesthesia providers working in Bujumbura, the former capital city, and there are approximately 400 certified non-physician anesthesia providers, and 50% from these are working in the public sector. We have an estimated 150 anesthesia providers with an informal education, either being physicians or non-physicians. The Burundi Anesthesia Association, named ATSARPS, Agora, the Techniciens, Supérieurs, Anesthésistes, Réanimateurs pour la promotion de la santé, is a non-profit organization registered under the Burundi law and was founded in 2016. It is a corresponding member of the WFSA, World Federation of Societies of Anesthesiologists. It's a full member of the IFNA, International Federation of Nurse Anesthetists, and full member of the WFCCN, the World Federation of Critical Care Nurses. Locally, it's a close partner of the Ministry of Health and the Ministry of Higher Education. I'm going to discuss with you Lifebox and ATSARPS partnership. Our partnership includes the distribution and monitoring of pulse oximeters in Burundi, as well as the delivery of pulse oximeter training and implementation of the WHO safety checklist to operating room staff and in supervised facilities. To give a little bit of context, I was walking into a rural area where we had no monitoring at all, and I was introduced to Lifebox through a friend. So I made an order of 2 pulse oximeters, and since then there was an interest into Lifebox pulse oximeters. So while being onto the run to create the Society of Anesthesia in Burundi, we went on to making a close contact with Lifebox Foundation. So after we had signed our memorandum of understanding, we began with a need assessment of all Burundi public hospitals, which was conducted into the beginning of 2017. And later, the same year, we had 17 Lifebox pulse oximeter, and they were donated, and our local team was trained to be trainers for continuing the Lifebox pulse oximeter training. This is the first training we had in Burundi in 2017. In 2018, we had 50 Lifebox oximeters which were donated to Burundi public hospitals. And in 2019, a subsequent lot of 54 pulse oximeters were donated into the same order for public hospitals. This is another picture highlighting the work of the 2019. And earlier in 2020, during the Global Surgery Anesthesia Cancer Symposium 2020, held at Hospital University, The checklist effect film was projected after signing the MOU with Lifebox for its projection, and we had a WHO surgery safety checklist training held then. And in mid-2020, with the surge of the COVID-19 pandemic, we had 200 pulse oximeters, which were donated into these contexts. And late into 2020 and early 2021, we got involved into the Smart Train Lifebox Pulse Oximetry Working Group for Lifebox revision of pulse oximeters education materials into the Smart Train context to include their materials. The work of Lifebox in Burundi has been highlighted into scientific journals. We had first the World Anesthesia News publication 2020, where the anesthesia courses in Burundi towards a hub of training and experience sharing. The chronology of the work of Lifebox was highlighted since the beginning. 2016, when we entered into contact, till now. And there was another article published into the South African Journal of Anesthesia and Analgesia, where we were looking for anesthesia facility evaluation, WhatsApp survey of hospitals in Burundi. And we found that 89% of public hospitals were using Lifebox pulse oximeters. This is a huge add for the work of Lifebox and ATSARPS, because in the beginning there was quasi non-existent, there was no pulse oximeters from Lifebox at that time, to my knowledge, because we did an assessment and we found that almost all the hospitals were lacking these equipments. But at a lifespan of 3 to 4 years, 89% of the hospitals were using Lifebox pulse oximeters. This is a short summary of the work we have been doing between Lifebox and ATSARPS for the Burundi context and surgical safety in Burundi. So thank you. This was my presentation.